All right, here we go. I couldn't resist a car rant. Number one, I think everyone is just on pins and needles waiting to hear my opinion on the Donald Trump announcement regarding the opioid epidemic being a public health crisis. Now, I'm sure everybody what does Rich think about that? Hey, did anyone hear what Rich said? What did Rich Jones think about that? I mean, I'm sure that's what's going on out there. So I don't want to disappoint. So here we go. What does Rich Jones think about Donald Trump announcing that the opioid epidemic is a public health crisis? All right, here's the first thing. Number one. All right, it's got to be a good thing when the President of the United States addresses addiction in any way, shape, or form and kind of comes out and he says it's a public health crisis. He talks about it as a disease, uses the term public health crisis. That's all good, especially whenever you think about how far we've come in terms of the stigma and, the embarrassment and the shame. Just the fact that the President of the United States is out there talking about it, that's wonderful. I wish it wouldn't have taken 500,000 deaths, 500,000 people dead to get us here, but we're here. So good part of the day. Second thing, there are legitimate recovery community organizations and advocacy organizations. Organizations like Facing Addiction, organizations like Faces and Voices of Recovery, other places that are really truly recovery advocates that work at it from a very planful, organized, politically astute point of view. And those organizations need to be congratulated. I'm not talking about recovery advocates who do their lead on social media over and over again and call themselves recovery advocates and really are recruiting people for treatment centers. I don't have a problem with those folks, but they're not the ones I'm talking about. I'm talking about like people who put a lot of time, energy, and money into politically moving the bar. And they did. They did. Because I don't think that Trump was going to say anything about this. I don't think he intended to say anything about it. Then Facing Addiction delivers tens of thousands of signatures on a petition. Faces and Voices of Recovery pushes the issue. Organizations like ours start talking about it. And what you have is, that's a good thing. It worked. Number three, and here's the bad part. I cannot for the life of me figure out what the hell it actually means to declare it a public health emergency. I've spent a lot of time today trying to figure this shit out. What does that actually mean? Are they going to throw a lot of money and are we going to be able to expand recovery support services? Does it mean that they're going to increase money availability for treatment beds? Does it mean that all of a sudden in South Carolina you're going to have more than 64 detox beds? What exactly does it mean? Here's what I found out. It doesn't actually mean shit. It appears the only thing that I could see that was consistently reported was there's going to be more money for medication-assisted treatment. And my rant today has nothing to do with medication-assisted treatment. But that is the only thing that was talked about in any kind of specific way in terms of what I've seen. And here's what I need to tell you. Look, man, you could I'm all for MAT. I want people to get better. I want people to stay alive. I don't care how you did it. I'm not one of those dudes who's going to run around saying, you got to do it this way or you got to do it that way. That's just not what I believe. I think people I think people in recovery who say things like, you got to do recovery this way, are demonstrating a fundamental closed-mindedness that is so problematic for me that it makes me wonder what kind of recovery program they're working. It really does. I'm so closed-minded that you got to do recovery my way. But anyway, that's not the subject of this rant. The subject of this rant is this opioid epidemic as a public health emergency doesn't come with any actual action attached to it, other than MAT. And it appears that MAT is the only solution that our federal government is willing to consider. So I'm going to tell you something. And I know that this is what you get when you have a one-size-fits-all treatment system that fails the majority of people. I know this is our bed. We got to lie in it. We made this. Our one-size-fits-all treatment system this is the result. Now they're just going to switch to a different one-size-fits-all treatment system, and it'll be MAT. But here's the deal. If you look, let's look at something like intensive outpatient therapy. Let's just take a look at that. 3 hours a day, 3 times a week. for a certain amount of money. I think here in South Carolina, although you can't always get the dollars because insurance, reimburses at different rates. Let's just say, for sake of argument, it's $2,500 a month. I don't know if that's accurate, but I've been told that. And you do 2 months, you do 8 weeks of IOP. I could give somebody recovery coaching for a year for that same amount of money that they get for completing one IOP program. Yeah, it wouldn't be for 9 hours a week. It might be for 2 to 4 hours a week, 4 to 6 hours a week. I can find a way to make it work. I guess what I'm saying is that there are other solutions out there other than 12-step abstinence-based recovery versus MAT. Those two polar opposites that everybody wants to talk about and everybody wants to get fired up about. So I'm happy that the Trumpster came out with and talked about it being a public health crisis. I'm not at all happy with the meat and the potatoes that follow that announcement, because it appears to be a whole lot more of like nothing. Smoke and mofo mirrors. All right, I better go. I'm running out of steam, and I'm going to start saying things I regret. I'll talk to you later.